Hi, I'm Alessandra. I'm a pediatric consultant and I arrived in Maldives in 2018 as a pediatric consultant. And I am right now the head of pediatric department and women and child department. And since the time I arrived in Maldives during my pediatric practice, I realized that fertility was an issue in Maldives because many of my infants and children they were born after fertility treatment, especially IVF abroad. So I started thinking that fertility was really a problem in Maldives. I think that is an enormous milestone for the country because, as I was saying, I realized as a pediatrician that fertility was an issue. So I started discussions with Dr. Barch and all my Obgani colleagues about this problem. And we started thinking about the possibility to develop to give some answer to this need of the population. And also thinking about how much is affecting one family in terms of work, profession, social life, how much is affecting to go abroad for months and months for fertility treatment. So we started discussing about the possibility to develop a fertility center at Ritop Hospital. And the concept, I think that this is an enormous milestone for the hospital, definitely, but for the country, because has been many actors have been working somehow together. The effort to define the guidelines with Dr. Zakia and with international expert, the enormous investment that the hospital made to develop the IVF center. So I think that is something really big and really needed and excellent answer to a real need of the population. Well, I see that this is, as I was saying, this is extremely important because um, if there is a need, you have a local answer to something that is uh, can be really affecting the well-being of not only of the woman, not only of the father, future father, husband, but is the whole family. The desire for a child that doesn't arrive in spontaneously is really painful. And I think that this is why many people were traveling abroad and sacrificing so much in financially, in terms also personal life, to have a pregnancy. And I think to give an answer locally is very important and a very highly specialized. I mean, to have a fertility center is not just to have a clinic, is something that is not only the enormous financial investment effort that the Tritop Hospital made, but also the need for highly specialized doctors, embryologists, and nurses, technicians. I mean, is a big achievement.
Hi, I'm Dr. Varsha Rengaraj, consulting gynecologist working in Treetop Hospital. I'm specialized in infertility and gynec laparoscopy. We encourage couples to come together for a fertility consultation, and we start with taking a detailed history of the couple, from the duration of marriage to years of trying for a pregnancy and what methods they have used to conceive naturally and otherwise. We also ask them about any past fertility treatments they have taken. And after all that evaluation, we go on to the physical examination and we ask for some blood investigations for the wife, including hormonal assays as well as ultrasound scan. And for the husband, we would do a basic semen analysis. We proceed from there after the evaluation of these tests. Any couple who has been trying to conceive naturally and have failed to do so can come forward for treatment at Fertility Centre in Treetop Hospital. If the couple are below 35 and have tried for 1 year unsuccessfully, and if they are above 35, after 6 months of trying naturally and they fail to conceive, they should come forward to a fertility doctor for evaluation.
So I'm Dr. Anita Gaur. I work as consultant IVF and reproductive medicine. I joined Treetop Hospital in October 2023. Since then, and the IVF program we used to do as a batch, and then we are doing it regularly on regular basis from April 2024, and we have achieved many pregnancies and some deliveries too. So we do treat a couple with fertility problems. For women, it could be women with low ovarian reserve, polycystic ovarian disease, or endometriosis or dual factor. For men, it could be problem with semen analysis, where there is problem with sperm count, motility, or morphology, and in some cases of azoospermia, where there are no sperms, where we get surgically retrieved sperms, and we do use them in the lab. So we have world-class technology, and our success is at par with international standards.
Hi, I am Dr. Zakia Ahmad. I am an obstetrician gynecologist and infertility specialist. So I was here from the beginning of when we had established fertility center. We had started fertility center. Given our treatments in batch wise. So that means we selected few patients and then beat IVF on them, and then again another batch would come. So initially when we started, we had a few cans to select our patients as well. Since then, we have progressed to doing, like Dr. Anita has said, we have progressed to doing on a daily basis. So the first patient who delivered, our first IVF baby was last year. So she was among one of the patients who came to the camp. But then she had previously done few cycles of IVF abroad. However, she was keen on doing another treatment here. It was not the most ideal case, but then she took a chance with us, and we are very glad and happy about that. So yes, she was among the first batch of IVF, and yeah, so we are very happy with her result. So, obviously, it was a great achievement, I would say, because she was among the five first patients that we have done IVF, and she had few previous cycles that was done abroad. So I would say this was for a infertility specialist. This was one of the main, the happiest milestones that we could have hoped for.
Hi, my name is Shahriar Parahmand. I am a embryologist working for over 1 year at Treetop Hospital. I'm from a beautiful Turkish area of Iran and completed my master's in clinical embryology and pre-implantation genetics with 5 years of clinical embryologist experience. So usually an embryologist does all the aspects in the IVF lab, from egg retrieval or egg collection, we call. So throughout must look into the details and culturing the embryos till usually day 5. So then either to transfer back to the uterus or freeze for the future. As you know, IVF treatment started around 1990s with around 5% of success rate. So it has developed until date where we have around over 40% of successful treatments. So it necessitates to move around the new updates and be updated all the time. And of course, the quality control in the lab, and in a very simple way, whatever can potentially affect the embryo growth. So we have to carefully maintain and so assure about the safety of the embryos.
We also had the RI witness.
Exactly. So particularly at Treetop Hospital, to not only minimize but eliminate the mix-up risk, which is one of the most main concern in IVF treatment. So we have established with the very interesting system, which is called RI witness system. So it is a digital witness system, which it makes it impossible to have any like specimen mix up during the treatment.
Hello, myself Dr. Munuswamy Narayan Sampath. I worked as a professor in India for around 10 years. Followed by that 10 years, I served in UAE, in Dubai. And then since last 1.5 years, I am overseeing the Department of Obs Gynae and IVF department. Here, my role is mainly to coordinate with all my colleagues and to see the smooth functioning, how we can hurdle-free work in the system, and induct all the patients in our Obs Gynae department, those who are routinely tried the IVF treatment. So if they have finished with all the normal natural way of conceiving, still they could not succeed, then I induct all these cases to the IVF care, where they will do a detailed analysis of such cases, and they will put them the necessary treatment for the IVF. Then mainly I will be there to take over all the IVF cases which have successfully worked out. Then all these cases will be inducted in our Obs Gynae department. We will be able to take care with my whole team of obstetrics gynecology till the pregnancy, whole 9 months of pregnancy, followed by delivery. And after that, we will introduce this little baby to our pediatric team. This is my main role in the IVF center. Yeah, it's our team's heart desire that our center of Treetop should reach the highest standards of care, which meets the international standards. And this we are going to all achieve by collaborating with each other, cooperating with each other, and teamwork, dedicated and hard work. We are planning, God willing, over a period of time to establish our center as one of the complete IVF infertility or a fertility care center, where we will be having all facilities, even including pre-genetic testing, so that we can test the genetic status of the embryo before implantation. This will be one of the earliest approach that we would be looking forward for. And then also we have at Treetop Hospital, we are taking care of all the cancer patients. So there are many young couples who are undergoing various cancer treatments. For such cases, to protect their fertility, we will be looking forward for preserving their ovarian tissue, so that after they finish all their cancer treatment, as their health recuperates by God's grace, that we can also make them available for fertility care, so that they can have their children even after their cancer treatment is over.
Well, I think that the level of our fertility center, even if I have to think and compare to what is available in Europe, is extremely high. So I think that I'm sure that also to stay in your own country for a treatment that is quite long very often, and also pregnancy and all that, I think can improve also the success. And so I really recommend all women who already have children, all families, to try to get this treatment in Maldives, because this was the main purpose of the initial idea we got in 2020, was to offer something for a real need of the population, to avoid them to travel abroad for long period of time.